So think of lungs as a balloon. When you inflate the balloon, you need pressure to drive the air inside. Same is with the lungs. Driving pressure is the pressure required to overcome the elastic recoil of alveoli and chest. It is calculated by subtracting PEEP from the plateau pressure. So 19 minus 6 is 13. So driving pressure is 13. Now it is advisable to keep the driving pressure below 15 centimeter of water, because it has been seen in ARDS studies whenever the driving pressure goes more than 15 centimeter of water, patients usually have bad prognosis.